La la la. Just kidding. Playtime with Lexi. Hi everyone, my name is Alexis. Welcome to Learning Time with Lexi. And today we are, drumroll please, learning about stroke. What is a stroke? Someone in the world experiences a stroke every 2 seconds. It is one of the common ways of death. But don't worry, not everyone gets it. And if you exercise a lot, you won't be getting a stroke. Learn, listen, look. When the heart beats, something prevents the upper chambers of the heart from contracting right, which makes blood flow slow down, allows platelets, clotting factors stick together, and it makes a clot. It gets carried up through the arteries until it reaches one it can't squeeze through anymore and brings blood flow to a halt, making brain cells die. There's 2 kinds of stroke, and this one is the most common one. It's called the ischemic stroke, and the hemorrhagic stroke that's much more easier to remember. Hemorrhagic stroke is when a perforated vessel leaks out. You kids watching might not know what perforated means. It means cut through, has a hole in it. And here's what doctors can do to cure strokes. Doctors can give this thing called tissue plasming something, I don't remember. And in a couple hours or more, you will feel better. That medicine breaks the clot apart. For special reasons when that medicine cannot be given, and the special reasons are because you're on certain medicines, or you had history of major bleeding, even bigger than cutting off your whole finger, really. Or the clot is big, big, major clot. And then doctors have to perform something kind of like a surgery. They use an x-ray to scan where the clot is and which artery in the head. And then they put this little string through one of the arteries through the leg. And when it gets to the clot, they tighten it and then pull it out because it ties around it. Here's a way to tell if someone is having a stroke. Because you can't feel it. The brain has no pain receptors. And ask someone to smile. If they have a crooked smile or facial drooping, that's a sign of a stroke. Second of it, ask them to raise their arms. If one wrist is down, that can mean that the part where the clot is in is blocking blood flow from the part that controls muscles. And third of all, ask them to say a simple word or phrase. If their speech is weird, that can mean that their language and speech part of their brain being blocked from oxygen. Test your parents if they have a stroke. Don't forget to subscribe and give a like and give a big thumbs up. Don't forget about the double thumbs up. Turn your notifications up. And then you will never miss a new posted video like this one. Woo-hoo! Flicks in your ear. That's how you know when you're having a stroke. Just kidding. I just want to make something up so it can be silly. Rated vessel.
I started again.
Vessel. I was telling you a secret method that I don't want to put on camera.
Okay.
I saw pictures of how clots look, and the clots, they are so disgusting when they pull it out. They are just gooey booey, chicken booey. Oh come on, why do I always like to put chicken in my silly words? And then so la 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 la.